Level 2 Fitness Instruction. Principles of Exercise, Fitness and Health. Exercise contraindications and key safety guidelines for special populations. By the end of this session, you will be able to describe the exercise contraindications and key safety guidelines for working with older people, 50 plus, for working with and postnatal clients, for working with disabled people, and for working with young people, 14 to 16. Contraindications exist whenever there is an increased risk of harm in any given activity and may exist regardless of age. Should any be identified during client screening, appropriate action should be taken. However, when designing a fitness-related program for the following special population groups, additional safety considerations are required. Age 50 plus, anti and postnatal, disabled, and young people. The key safety guidelines when working with clients 50 plus. To minimise the risk of any adverse events when working with 50 plus, the following guidelines should be followed. Always complete a PAR-Q prior to exercise. Plan a longer warm-up and cool-down. Keep the intensity of all training components to a light to moderate intensity level. Ensure correct technique. Take more time during exercise transitions, e.g. from the floor to standing. Simplify exercises. Begin new exercises in the easiest position and or the lightest resistance and progress slowly. Avoid extreme spinal flexion. Key safety guidelines when working with pre- and postnatal clients. This information relates only to normal, healthy adult women experiencing a normal, healthy singleton pregnancy, or who have had a normal, healthy birth and who have had previous normal, healthy pregnancies and births. In most cases, exercise is safe for both mother and baby. Exercise at appropriate intensity for the individual concerned is not associated with adverse pregnancy outcome. Women who have not exercised prior to pregnancy should begin with just 15 minutes continuous aerobic activity, increasing gradually to 30 minutes continuous aerobic activity over time. Pregnant women should maintain adequate hydration during exercise, avoid exercising in very hot and humid conditions, and consume adequate calories. They should restrict exercise sessions to no longer than 45 minutes. Monitor intensity according to how they are feeling, encouraging the use of the talk test and RPE. Here are some things they should avoid. Exercising in the supine position after 16 weeks of pregnancy. Prolonged motionless standing. Heavy, uncontrolled, isometric or resistance work above the head. Leg adduction and abduction against a resistance. Loaded forward flexion. Rapid changes of direction or position and uncontrolled twisting. Any exercise with a risk of falling or abdominal trauma. And excessive and uncontrolled destabilization exercises. Although it is safe for pre- and postnatal clients to exercise, exercise should stop if any of the following is experienced: dizziness, faintness or nausea, bleeding or leakage of amniotic fluid, abdominal or contraction type pain, unexplained pain in the back, pelvis, groin, buttocks or legs, and excessive shortness of breath, chest pain or palpitations. Key safety guidelines when working with disabled people. Because of the various kinds of disabilities, Describing specific components of exercise prescription for each condition can be difficult. This section is going to focus on the following categories of disability: physical disabilities, spasticity, neurological conditions, damage to sensory nerves, and depression. Physical disabilities. Although exercise cannot always directly improve a physical disability, it can certainly improve a client's general health and well-being. Progressive disorders, such as multiple sclerosis, require careful monitoring to ensure that the exercise program is not causing the condition to worsen. Clients with asymmetrical weaknesses, such as those that have had a stroke or are suffering with cerebral palsy, may have a difference in strength between the left and the right side of their body. The fitness professional should aim to improve the affected side as much as possible, without neglecting the side which is unaffected. Spasticity. Spastic muscles are very tight or rigid. However, although flexibility training can be extremely beneficial, before incorporating any flexibility into a program, the instructor should seek authorization from a suitably trained medical authority on how to stretch a spastic muscle without causing injury. Neurological conditions. Muscles can become progressively weaker as a result of the decline in CNS functioning. Programs should therefore concentrate upon general fitness levels. However, should there be any rapid decline in function, the client should immediately be referred back to their GP for guidance. Damage to sensory nerves. Since this occurs with many types of physical disabilities and may result in an inability to detect pressure against the skin, left untreated, this can result in a pressure sore. Although the client will already be aware of the importance of frequent checks, the instructor should also make the client aware that the use of gym equipment may also bring similar associated risks, requiring extra vigilance. Depression. Depression is a common secondary condition resulting from the challenges of living with a disability. Occasionally, depression can cause a person to drop out of an exercise program. Extra efforts to motivate clients and to work on exercise adherence will be necessary. Key safety guidelines when working with young people. When designing a fitness program suitable for children and adolescents, there are several key areas which need to be considered: growth-related issues, flexibility, stage of anatomical and physiological development, suitability of equipment, and appropriate training goals. Growth-related issues. Avoid excessive training, including playing too much of one sport and playing the wrong sport for the body type. Avoid using heavy weights when resistance training. Remember the gender differences and the differing stages of development within the same sex. Avoid inappropriate size matching, especially in pairs. Avoid excessive stationary high-impact moves. Always teach an appropriate warm-up and cool-down. And always provide appropriate equipment for the activity. Flexibility. Caution should be taken when teaching any stretch, especially during growth spurts. Muscle growth does not keep up with bone growth. The soft tissue around the joints is stretched, leading to an increased injury risk. Anatomical and physiological development. Cardiorespiratory system. Since children have a smaller heart and a higher heart rate than adults, higher intensity training should be avoided. Body temperature and dehydration. Due to low blood volume and high skin temperature, children have an inferior cooling mechanism and are therefore sensitive to heat stress. Ensure adequate hydration. The warm-up component may need to be less intense and shorter. Incorporate active rests in between bouts of vigorous activity. Gymnasium equipment. The resistance machines in most gyms are generally too large for young people. The use of free weights is therefore a much better choice. Technique. Begin any program with non-complex, low-resistance exercises, normally duplicating everyday activities, progressing only once proper technique is perfected. Training for power and bodybuilding. Pre-adolescents and adolescents should avoid powerlifting, bodybuilding and maximal lifts until they reach physical and skeletal maturity. Body weight and plyometric exercises such as jumping, sprinting and bounding are considered to be safer alternatives for developing power in younger athletes. Can you now describe the exercise contraindications and key safety guidelines for working with older people, ante and postnatal clients, disabled people, and young people? For more health and fitness education, visit www.stormfitnessacademy.co.uk.